Pterygium is a growth of skin onto the surface of the eye or onto the cornea. I use the analogy of like a callus on the hand or skin that is natural, normal skin that thickens in response to some kind of an inciting incident. On the eye, it changes with sun exposure. So we do recommend people protect their eyes, particularly in Southern California, with sunglass protection. Once a pterygium has grown or started to grow onto the cornea, it can restrict the vision if it encroaches the pupil or the visual axis. When that's the case, these are removed surgically. The pterygium is removed from the eye as far as a peeling type procedure. This is done in an operating room, and possibly some grafting may be necessary to promote the best healing for the eye. Macular degeneration is a retinal disease caused by an aging change of the macular tissue. This is usually seen as quote-unquote aging spots that develop in the macula. These can progress and distort and damage the normal cells that are in the macula, which can reduce a patient's vision. There's a couple types of macular degeneration, commonly referred to as dry or wet. The dry is simply the aging changes that we see as aging spots. Wet refers to blood or bleeding in that same area. I would tell a patient who has the earliest signs of macular degeneration or the beginnings of it that unfortunately there is no true therapy to stop it or eradicate it, but there has been some vitamin therapy studies that show this is beneficial to a patient's eye for the long term. If a patient does then progress what is usually considered a more severe stage into the wet form, there are other laser therapies that can be used for that patient. This sometimes does need referral to a retinal specialist to treat that if indeed it is progressing.